Hi, I'm Dr. Julie Lamb, and I'm going to walk you through what it looks like to do IVF here at Pacific Northwest Fertility. So by the time you come to your first appointment for IVF, you've often already had all your testing, you already have a calendar, you've ordered medications, and you're ready to start the process. At the first visit, you can expect a baseline ultrasound, a blood draw, and a visit with your nurse coordinator. So at the ultrasound is often done by your physician, and it's just checking to make sure your ovaries are quiet and ready to start the process. The estradiol level is a blood draw, and this is done throughout the process of IVF, and it just also confirms that you're ready to start. And then the final component of that first visit is meeting with your nurse coordinator to review the medications and the calendar and making sure you feel confident to start the process. So one of the most common questions I get between the baseline visit and starting stimulation is related to bleeding. And I really want my patients to know that it's okay to get a period. It's okay not to get a period. The most common side effect before starting your stimulation medications or in the first few days of those stimulation medications is a little bit of a headache. And that's common, it's normal. You can stay hydrated, you can take some Tylenol. So over the next 2 weeks, you can expect to be monitored during your IVF stimulation 4 or 5 times. These visits include an ultrasound with your provider, a blood draw to determine estrogen level, and a review of your calendar with your coordinator. We also take time to answer all your questions, make sure you have enough medication, and make sure that the next steps are really clear. Most common things patients say is that they feel fatigue and bloating related to the stimulation medications. It's really important to make IVF your priority and build time into your schedule during those 2 weeks to rest and take good care of yourself. So another common concern of patients is pain or inflammation around the injection site, and while this can be uncomfortable, it doesn't affect the outcome of your cycle. On the morning of your retrieval, you want to take really good care of yourself. You want to remember not to have anything to eat or drink. You want to leave yourself extra time to get to the clinic so everything can occur in a low stress setting. You check in at the front desk, they bring you back to the procedure area, they have you change into a gown, you meet the procedure team that's going to take care of you. Oftentimes you even get to meet the embryologist that's going to take care of your eggs. And then the physician comes, you fall asleep, and we get the eggs out. When you wake up from your egg retrieval, you find out how many eggs were collected, and then you get to go home and rest for the rest of the day. Occasionally patients will have spotting or cramping after the egg retrieval, so it's really important to take care of yourself and really give yourself time to recover. During the next few days, you get updates about how your embryos are doing in the lab. The decision to do a fresh embryo transfer versus a frozen embryo transfer in a subsequent cycle really depends on your own personal situation. So it's important to understand that not every egg makes a baby, so not every egg will be fertilized, and not every fertilized egg will go on and continue to grow as an embryo. It's this natural process that occurs in the lab that helps us select the best embryo that's most likely to cause a pregnancy. If the plan is for you to freeze your embryos, I tell patients to expect a period in 7 to 10 days. And this period, I like to warn them that sometimes it's a little bit heavier or a little more crampy as the ovaries return to their normal state. I'm hoping that by watching this video, you know a little bit more about what to expect from IVF. It's really important that each patient feels well taken care of and has a good experience.